Let us see some fascinating images in otology to give us a profound understanding of the ear architecture. This is a architectural layout of the middle ear. Here you note is the adytus through which it communicates with the mastoid antrum, and thereby the entire architecture of the mastoid hair cells acts as a baffle through the small little window. Now, this is the malleus and that is the incus. And if you look at that articulation, it looks like a kiss and therefore called the eternal kiss. Now, look at the head of malleus and the body of incus suspended by two ligaments, the ligament of the malleus and the superior ligament of the incus. Now, the malleus has an anterior process, but this is the lateral process. Now, the handle of malleus descends downwards, backwards, and inwards. It is this inward angulation of the head of the handle of malleus that gives the tympanic membrane a conical shape. You require a conical shape in order to correctly reproduce the entire frequency spectrum, just like in your speaker. The speaker cone is cone shaped. Therefore, if you were in the reconstruction to put a graft on the handle of malleus, the graft will be straight. You will nicely reconstruct, but the patient will say, my hearing reproduction is not as good compared to the other side because it requires the cone shape. How do you get the cone shape? By insinuating the graft underneath the handle of malleus and then on to the bare bone, on underneath myringoplasty. It is only when you tuck it underneath that you get the cone of the eardrum. In case there is a sudden sound, the middle ear ossicular system has to be stabilized. How does nature do that? Number one, the tensor tympani tendon curves around the cog, insert into the muscular process of the neck of malleus. Number one. Number two, the only muscle inside the bone, the stapedius, passes forwards to insert into the neck of stapes. And when there is an anticipated sudden sound, both these muscles in a split second will contract and stabilize the ossicular chain. What a fantastic reconstruct! Now, this is the prominence of the facial canal, that is, the stapes inserted into the oval window. And if you observe carefully, this is the facial nerve passing in this fashion, and that will be the second genu passing downwards. On the promontory will be an arborization of the nerve plexus. This is called the tympanic plexus. What a wonderful picture this is of the eardrum. The annulus, Gerlach's ligament, all across except in the upper part where the annulus is absent. And here we have the thin pars flaccida. Why is it flaccid? Because the middle fibrous layer is absent, unlike here where the middle fibrous layer is present. Why has nature, designer, God, universe made this flaccid? If you observe carefully, a sudden outward excursion of the head of malleus will hit, and if it is not flaccid, will rupture. And therefore, whoever who designed it made this flaccid, pars flaccida. Again, the handle of malleus downwards, backwards, and inwards, giving the cone a conical, giving the eardrum a conical shape. The upper part is the epitympanum, the middle part is the mesotympanum, and the hypotympanum. But what we need to observe is the tensor tympani muscle passing forwards, converting into a tendon to be inserted into the neck of malleus. This shows the microarchitecture with the facial nerve passing backwards the tympanic portion of the facial nerve, the mastoid segment of the facial nerve. It passes between the lateral semicircular canal and the oval window where the stapes is inserted. Look at the tensor tympani hooking around the cog and getting inserted into the neck of malleus. Now we have here the ossicular chain. Projecting forward from the malleus is the anterior process of malleus. We have the head of malleus, the neck of malleus, the handle of malleus, and here we have a tiny cap by our legendary otologist named after him, Dr. Mahadeviya's cap. Articulating with the head of malleus is the body of incus. If you note, the incus does not have a head, it's got a body and it's got a short process. Passing backwards, the short process of incus. So, if you look at the long axis of rotation, it is the anterior malleolar tendon, the anterior process of the malleus, the neck of malleus, body of incus, short process of incus, and the posterior inguinal ligament. The long process of incus descends downwards, converts into the lenticular process, and inserts into the head of stapes, from where the neck diversifies into the anterior and posterior crus. Look at the malleus. It's got a head, it's got a neck, it's got an anterior process, the lateral process, which when the eardrum is observed manifests as the lateral process, small little knuckle shaped projection. The first indication that there is a negative pressure here is when the eardrum retracts, the lateral process becomes prominent. This is the handle of malleus, and from this point, when you observe from externally, the light concentrates called the cone of light. Again, this is the posterior view, the articular surface, neck of malleus, lateral process of malleus, handle of malleus. Incus has an articular facet for on the body of incus, the short process pass projecting backwards ligament of incus to be inserted into the fossa incutis, the long process of incus and the lenticular process. The stapes, it's got a head, it's got a neck, it's got an anterior crus, posterior crus, and the foot plate. Now this is the base of the foot plate, and it is into the posterior part of the neck that the stapedial tendon gets inserted. Again, this is the only muscle inside a bone, the stapedius muscle. Its tendon emitting out of its pyramid, passing forwards to attach to the neck of stapes. Look at the short process of incus, the posterior ligament of incus passing backwards to insert into the fossa incutis. The two ligaments that suspend the superior ligament of malleus, the superior ligament of incus. Now, if you look carefully, passing between the malleus and the incus is this nerve, the cauda tympani nerve. This shows the folds and its architecture. Above is the superior recess of the tympanic membrane. This is the lateral ligament of malleus. Malleus, incus. This is the superior malleolar fold. That's the cauda tympani passing forward in that small tiny fold there. This is the lateral process of malleus causing a prominence, and this is the tympanic membrane. The tip of the handle of malleus is called the umbo, from where the cone of light concentrates, called the cone of light. We must know the two lines which are drawn. A line is along the handle of malleus, another line perpendicular and bisecting at the umbo, dividing the eardrum into four quadrants: antero superior, antero inferior, posterior superior, posterior inferior. Now, passing from the malleus forwards and backwards are the anterior and posterior malleolar fold, and formed by the lateral process of malleus is the malleal prominence. Now, vibration of the tympanic membrane causes a rocking movement in the ossicular chain along this long axis. The mechanical advantage of the lever action of the ossicular chain amplifies the sound waves by a factor of 1.3. Because of this axis rotation and the lever movement, it is amplified 1.3 times. The stapes in its normal position lies in the plane of the oval window. This is the pyramidal eminence, the stapedial tendon, the oval window with the annular stapedial ligament. However, a rocking of the ossicular chain causes the stapes to tilt. The movement of the stapes base against the membrane of the oval window, that is the stapedial membrane, induces corresponding waves in the fluid column of the inner ear. This is the blood supply, how nature keeps it well nourished. We have here the deep auricular artery. These are the radial vessels. What are its contribution? The deep auricular artery, the inferior tympanic artery, the posterior tympanic artery, the stapedial branch of the posterior tympanic artery, and the anterior tympanic artery, all of which richly supply the medullary architecture. This shows the various fibers of the eardrum, the radial fibers and the longitudinal fibers both interlace to give the eardrum its great architectural integrity. These are parts of the temporal bone. We have the squamous part of temporal bone, the mastoid part of temporal bone, the tympanic part of the temporal bone, and inside a pyramidal shaped structure called the petrous part of the temporal bone. And then we have the styloid process, the four parts of the temporal bone and the styloid process. These show the various ligaments. In front is the anterior malleolar ligament. Suspending it above are the superior malleal and superior inguinal folds. Posteriorly is the posterior inguinal ligament, all of which suspends the ossicles in the medullary cavity. I repeat, anterior malleal ligament, the anterior malleal ligament, the superior malleal ligament, the superior inguinal ligament, and then the posterior inguinal ligament. This is a spatial discretization of the medullary geometry. And now we know that the eardrum comprises of several drums simultaneously vibrating for various frequencies, and that is how various frequencies are reproduced. As in this beautiful diagram, this is one component, that is the second component, that's a third component. This tells us how the eardrum is able to completely reproduce the entire frequency spectrum, which in our music system we require a tweeter, woofer, mid-range, all of which reproduced by one eardrum, because there are multiple drums simultaneously working, reproducing the entire music spectrum. So I hope these fascinating images have given you an insight into the wonderful architecture of the ear.